We are on a mission, as I've said before, to reform, delivering equitable, comprehensive and quality healthcare for the people of Jamaica.
The government's mission of guaranteeing adequate, effective and efficient public health service in the new fiscal year comes with a price tag of over $125 billion. $118 billion is allocated for recurrent expenses, inclusive of budgetary support to the Bellevue Hospital and government chemist. The ministry will offset that with $530 million earned from fees collected. And government and its international partners will also spend $6.42 billion on major health projects. A large portion of the money will ensure the 23 hospitals, 336 health centers, and specialized institutions in the 4 regional health authority areas are equipped to deliver first-rate service to Jamaicans. This includes operational support for the National Public Health Lab, the Blood Transfusion Services, and Immunology Unit, as well as health standards and regulations, procurement of pharmaceutical and medical supplies, and regional health system support. Another $10 billion is to cover approximately 68% of the operating cost of the University Hospital of the West Indies, and just over $9 billion is for the overall administrative services and regulatory expenses of the ministry. In the new fiscal year, 5 health improvement projects will be jointly funded by the government and its bilateral and multilateral partners at a combined cost of $6.4 billion. Interventions will continue to reduce AIDS-related illnesses and deaths, prevent new HIV infections, and provide testing, treatment, and counseling for infected persons. Progress is being made on the construction of the Western Children Adolescent Hospital and redevelopment of the Cornwall Regional Hospital.
We're on the 5th floor of 8. And it is going well, and the technical audits that are taking place parallel to construction suggest that quality is being assured. We're building a brand new hospital. The only thing that has not changed is the original concrete structure, and even that has been reinforced in a significant way. Roofing, reinforcement of the beams, the columns. So the bulk of the expenditure is going into producing a new hospital. The partitions, the equipment, all the things for a modern hospital.
As for the 4-year project to modernize the University Hospital of the West Indies, this year the ring road will be rerouted and a new car park constructed. Designs will also be commissioned for the upgrading of the electrical grid, potable water supply, sewage network, and IT infrastructure. The 5th Capital Development Project is for the prevention and care management of non-communicable diseases, NCDs.
It's really has its foundation in the approach to treating with lifestyle-related disease, NCDs, which, as you know, has been a 70% cause of deaths of Jamaicans, a big cause of death globally, and something that we have to do in terms of adjusting to track lifestyle and behavior to see where people are vulnerable and to treat with those persons.
As part of this project, designs are to be completed for the construction or renovation of 12 facilities during the fiscal year. It will also involve starting construction at the Spanish Town Hospital, finalizing corrective and preventative maintenance work at the Maypen Hospital, commencing the procurement of civil works for 3 health centers, and getting started on sewage studies for 10 health facilities. The 2023-24 targets also include application of the Jamaica Moves app nationally and continued implementation of the electronic health record system.
The electronic health records, are EHR, and we'll refer a lot to it now as EHR for short, is in fact the wave of the future in healthcare delivery. And for Jamaica, we are proud to be the only country in the Caribbean that is moving ahead with this. It is potentially changing the way we administer patient care, and in a very short phrase, it improves by reducing transaction time, transaction cost, and improve the quality of service provision for the patient in our public health institution.
These are just some of the ways in which the Ministry of Health and Wellness will be investing in the well-being of Jamaicans for 2023-24.